just had one question. This is not necessarily for you, actually. The one I picked out of the parade of doctors, but anyone could answer this question. It's specifically the baby issue and the baby formula exposure issue. Can someone address that, if there's data on that?
I'll answer that.
I heard your view of it. I just didn't hear the opposing view. And then say which doctor you are when you.
Okay, I'm Howard Pollack.
Okay, go ahead, sir.
I'm at UCSF. Your question is with the baby issue.
There was a concern that the level of fluoridation was too high for babies to drink, and
right. And you know, the American Academy of Pediatrics recommends breastfeeding for infants. However, the majority of children are not breastfed, and you know, ever since time began, almost there's been alternatives to breastfeeding. So we recognize that with increasing knowledge and science base in terms of fluoride intake from all sources, that young infants, when they are receiving powdered infant formula or formula that's concentrated and has to be diluted with water, that young babies will receive a lot of water. And some will receive higher than what is considered to be the tolerable upper intake, whereby after in excess of that, there's a chance of developing dental fluorosis, white streaking of the teeth, as those teeth are developing. And so this guidance was issued, as you've heard, to provide information so that risk can be balanced with the risk for tooth decay when considering what kind of feeding practices should be used for infants. If infants are using the ready-to-feed formula that doesn't need dilution, then there's no issue. So that when using an infant formula that needs to be diluted, we're recommending using distilled water that is available at stores.
So you'd recommend just has no chemicals in it?
That's correct.
Okay, excellent.